You're listening to Trax FM's podcast. If you've enjoyed our content, more podcasts are available on the RTM Click app and website. Let us know what you think. Please email us at traxfm.rtm@gmail.com. Like and follow us on social media at Trax FM Official.
Well, that's right. Good morning, everybody. Welcome back. It is Health on Trax, and you're with me, Anil, on the mic, live and direct from studio number 5. It's Trax Momentum, and on Mondays, we'll be having our interview feature, which is called Health on Trax. Yes, and on today, on this edition of Health on Trax, we're actually going to speak about a very critical topic, which is stroke rehabilitation. And to shed some light and give us some detailed insights on the nitty-gritties of all of these things is our special guest in the studios, Dr.Sakinah Sabirin. She's a rehabilitation physician at the Department of Rehabilitation Medicine of University Malaya Medical Center. Dr. Sakinah, good morning and welcome to Trax.
Good morning, Anil, and thank you so much for inviting me here.
Absolutely. The pleasure is ours. How are you doing today?
Well, we're doing okay. I did rounds this morning, so
right.
A bit busy.
Okay, great. So before we start things off, Doctor, before we dive deep into our conversation, which is stroke, perhaps you can just give our listeners a very brief introduction of yourself and your work with stroke patients.
Hi, I'm Sakinah. I'm actually a specialist in rehabilitation medicine. We also call it rehabilitation physician under Department of Rehabilitation Medicine in University Malaya Medical Center. So my special interest is actually neurorehabilitation, and the bulk of our work is actually stroke rehabilitation, but we also cater things like inflammatory diseases and motor neuron diseases. I also do pediatric rehabilitations at the same time, so looking at the cerebral palsy. Yeah, that's about it, I think.
Okay, great. Now, Dr. Sakinah, starting off with our conversation, for the benefit of our listeners who may not be familiar with the term stroke, or maybe it's a very oftenly heard term, but maybe you don't really understand or understand any context behind it.
Yeah.
Could you please explain to our listeners what is a stroke and why is it a matter of concern to all of us? Why should it be a matter of concern?
So, stroke is very, very important. In fact, it's actually the 4th cause of disease in Malaysia last year. So, when you think about stroke is actually a medical emergency. So time is very, very important. So what happens in stroke is that you have loss of blood flow to your brain. And the reason why you loss of the blood flow can be actually various causes, which I will talk about after this. But because of the loss of blood flow, there's lack of oxygen that your brain cells direly needs. So when you don't have enough oxygen to the brain, then the brain cells start to actually die. And it causes a lot of damages for your brain tissues. So when your brain tissues actually start to get a lot of damages, your brain cells die, then you start to actually lose the function that the brain controls. So think about your brain. I always say to my patients, think about your brain as the motherboard of your computer. It controls every system. It controls every function. So certain parts of the brain control different parts of function. For example, the front part and the middle part typically controls your thinking as well as your motor movement.
Is that what they call the prefrontal cortex or something?
Yeah, the prefrontal cortex is more of the cognitive part, and you have the motor cortex, which actually control your movement of your limbs, like upper limb and your lower limb, or hands and arms and legs. So when you have stroke at that site, you have cell damages at that site, so you lost control of that, and you lost the connection to actually, pass through the signals to actually control it properly. And so when you got a stroke, that's why you start to get actually weakness of your hands, or sometimes in certain cases you even have total loss of function of your hands and your legs. And in certain cases where, like you mentioned, if you hit the prefrontal cortex, then you actually will get a lot of cognition issue, memory issues,
right.
And it affects your sensation as well. And it does affect, if it's at the back of your brain, then it affects your vision and it also affects your balance.
Right. Okay. Never knew all of these things, will get affected when you suffer from a stroke.
Oh, yes. It really depends on how big it is stroke,
right,
the location of the stroke.
The severity of it.
Exactly. So that's why it's very important for them to seek medical attention as soon as possible.
Okay. Now, Dr. Sakinah, of course, you mentioned very, very, very briefly, very nicely that essentially a stroke is when there's loss of oxygen that goes to the brain, right? Now, which is, you explain the causes of it. Now, what is our daily lifestyle that may lead towards such a thing happening in our lives? Maybe you can give us some context to that.
Because if you think about the stroke, why you lost the blood flow, generally it can be because of two major causes, which is ischemic as well as hemorrhagic. So ischemic is more common. So when we call it ischemic, it's actually because where your blood vessels to the brain is actually blocked either by a clot that travels from somewhere else, or it's actually because of the collection of the plaques or the build-up made of your fatty deposits and cholesterols. And on the hemorrhagic side, they are typically where your blood vessel bursts and the blood spill directly onto the cells and causing a lot of damages. So why would you have that? Why would you have thickening of the plaques? Why would you have like poor blood vessel elasticity that caused the burst, the hemorrhagic stroke and all that? One thing that actually important, not one thing, a group of things that are actually important are what we call modifiable risk factors. High blood pressure.
Okay.
So because that can actually cause damages to the wall or the vessels. Diabetes, they can actually contribute to the build-up or the plaques thickening in your blood vessels. And if you have high cholesterol levels or lipids, or if you smoke, which can double the risk of getting stroke. If you have obesity, that's not controlled. If you have sedentary lifestyle, you don't do exercises, and you don't really, do a lot of physical activities, and as well as if you have ischemic heart disease.
Ischemic heart disease.
Yeah, exactly. So typically, those who has ischemic heart disease or have like previous heart attack, or if they have what we call atrial fibrillations, which is arrhythmia of the heart, then they can actually increase the risk of them getting clots to the brain.
I see. Okay. Now, Dr. Sakinah, well, it's understanding risk factors is very crucial as well. Can you shed some light on who is more likely to be susceptible to a stroke? Is there a demographic? You mentioned that was the fourth highest cause of death as well in the country. Does it lead to? Have there been cases of deaths reported because of stroke?
Yes, there are actually plenty of death that is actually attributed to stroke. The ones that we look for,
age group is
the
there?
age groups, typically is actually the elderly age. So the more advanced age that you are, then you are actually more likely to get stroke. So at the same time, male are actually more likely to get stroke, but that kind of because of female factors that's actually protective. So once you hit the menopause, actually you lost that female protective factors. So that's why the age comes too. And then as well as if you have strong family history.
So it's hereditary as well?
It can be hereditary in certain cases where we see that a lot of patients actually have a family history of stroke, or family history of heart disease, or if they have like early onset of diabetes, if they have obesity, or if they have triglyceride or high lipids, then they are at risk of stroke as well. And apart from that, the modifiable risk factors that I was talking about.
And how does one get assessed for early intervention per se, Doctor?
So usually for us, especially if you have already reached 30 and above, we would actually advise you to do regular checkups. Check your blood pressure, make sure your sugar is actually within the normal limits. And, at home yourself, you can actually monitor your own diet, your own weight level to your height level or your fat compositions of your body, and make sure that you actually do healthy lifestyle.
Have a healthy lifestyle, monitor our blood pressure, have a healthy diet, exercise as often as we can. We all hear these things being, propagated to us. It's like the Holy Grail. The gospel is always being taught to us.
Yes.
But, sometimes it's easier said than done, right, Doctor?
Exactly. And in fact, some of our patients, unfortunately, when they come over, they're not on any medication. So we ask them, have you ever checked your blood pressure? Have you ever checked your glucose before? And some of them would say that they have checked, but they feel that they want to change their diet, to try to do more exercises before they actually start medication, and they don't attend regular follow-up.
Right.
So to me, if you already notice there are some irregularities, like your blood pressure on the higher side or sugar on the higher side, you can actually talk to the doctors that actually diagnose you with that, I want to try diet first. I want to try exercise first. Can you give me a bit of time? Can I come back to you? But you need to have regular follow-up.
All right. So we can perhaps, procrastinate medication.
Well, I wouldn't recommend that, no.
Unless
But
you are at the very early stage of detecting
exactly,
it.
like pre-diabetic or the hypertensive is only borderline. But if you need medication, then you need medication.
Of course.
And it is, I mean, sometimes I think patients have this like a shock that, oh no, I need medications now.
Yeah.
Oh no, am I going to be on the medication for my whole life?
That's the biggest fear, right?
Yes, exactly. But to me, if you think about it, you have enjoyed your body for quite some time when you were young. It's time to treat it as, TLCs.
Tender loving and care.
Exactly,
right?
exactly. So unfortunately, yes, we don't like it, but we have to do what we have to do because the consequences are dire. You don't want to get ischemic heart disease.
Yeah.
You don't want to get a heart attack. You don't want to get a stroke as well.
Okay, great. Interesting discussion. Dr. Sakinah, we'll go in for a quick break, and when we come back, we shall resume with the discussion. And for all of our listeners who just tuned in, I'm now speaking to Dr. Sakinah Sabirin. She's a rehabilitation physician at the Department of Rehabilitation Medicine of University Malaya Medical Center. And today on Health on Tracks, we're speaking about stroke rehabilitation. So keep it right here. When we come back, we shall resume with the discussion.
Worried about your health? Health on Tracks every Monday, 11:15 to 11:45 a.m.
Good morning, everybody, and welcome back to Health on Tracks. I'm Anil on the mic, live and direct from studio number 5. And today on Health on Tracks, we're speaking about stroke rehabilitation with our special guest in the studios, Dr. Sakinah Sabirin, who's a rehabilitation physician at the Department of Rehabilitation Medicine, University Malaya Medical Center. And also for the benefit of some of our listeners, we also can be seen live on Facebook via our official Facebook page at Tracks FM Official. So you can head over there to get a feel on how our guest actually looks like and how do I look like today, all in white. And perhaps if you have a question that you may be keen to pose to our doctor, of course, feel free to do so. Dr. Sakinah, welcome back to the discussion.
Thank you.
Great. So earlier on, before the break, Dr. Sakinah, we spoke about, what a stroke is, what are the causes of a stroke, early intervention, detection, so on. Now, what are some of the early signs of someone who is about to encounter a stroke?
We don't exactly have like someone about to get a stroke, but you can actually see when they are getting the stroke.
Okay.
So we have the acronym called BFAST. So it's BEFAST. So B stands for balance, E for eye, and F for the face, the A is for the arm, and S for the speech, whereas T is actually time to actually call the ambulance. So if they have as we mentioned, posterior stroke, then they may actually have balance issue. So the main complaints will be that, I'm having a lot of difficulties to get up from the bed, I'm falling when I'm walking, or I feel dizzy. And sometimes with the eye, they can actually have vision loss, either, half true, or they can actually have full vision loss. And for the face, they can have facial drooping, or you can see that the facial is asymmetric on one side. And then for the arm, they can actually have weakness of the hands, and that actually extend to the legs as well. So you can actually ask them to lift up their arm, and one side wouldn't be able to lift it up.
Okay.
And then you can also have speech difficulties, so they can tend to actually slur. So, in fact, one of my patients, he was actually living alone, and the reason why the family brought him over is that when he was on the phone with them, they couldn't understand what he was talking about. So
it was slurring.
Yeah, exactly. But he didn't realize it himself. But then on the phone, it was quite prominent. So the family actually ran over to his house and brought him over to the hospital.
How old was he?
Can't remember, 60 plus, 70 plus.
Okay, right.
Yeah, around that age. So T is time. So when you have all those symptoms, or if you have either or one of the symptoms, then you should actually bring either you yourself call the ambulance, or if you couldn't call the ambulance, the family members should actually call the ambulance to bring the patients where the stroke is actually being treated, if they have stroke unit or the neurologist, that would be the best. Because then in terms of stroke, when you have brain cell damages, as the time is actually the most important component. As you dilly-dallying, then you have more brain cells damage. So when that happens, then the recovery would be even less, and you have poorer prognosis.
So we've got to act upon it really fast.
Exactly. So ideally, within 3 hours, the patient should actually reach the hospital.
Right. Okay. Thank you very much for shedding some light on, some of the early signs, doctor, on we should look out for when somebody's having a stroke. Let's jump in for another quick break, and then when we come back, we shall resume with the discussion and find out in detail of the things that happen after a stroke. All right?
Yeah.
I'm now speaking to Dr.Sakinah Sabirin, a rehabilitation physician at the Department of Rehabilitation Medicine of University Malaya Medical Center. And today on Health on Tracks, we're talking about stroke rehabilitation. Keep it right here. We'll be right back.
Worried about your health? Health on Tracks every Monday, 11:15 to 11:45 a.m.
Health on Tracks with Anil on the mic, and of course my special guest in the studio, Dr. Sakinah Sabirin. She's the rehabilitation physician at the Department of Rehabilitation Medicine at University Malaya Medical Center, and today she's speaking to us about stroke rehabilitation. Dr. Sakinah, welcome back to the discussion.
Thank you, Anil, for inviting me.
You're welcome. Pleasure's ours. Now, earlier on, before the previous break, we understood and we delve deep into some of the early signs of someone who was about to have a stroke. Now, give us a picture on the quality of life of someone who has suffered from a stroke. How does it affect them? What are the things that is no longer the normal for them? What is the new normal, so to speak, for them?
Okay, thank you, Anil, for that question. So, when somebody had a stroke, as we mentioned before, different parts of the brain will actually affect different function, but the typical symptoms are usually there are weakness of the hands and the leg, usually unilateral, and in certain cases they have swallowing problems, they have speech difficulties. So it can actually cause permanent disability to the patients. So you can imagine somebody who previously was able to walk, previously able to, self-feed, put on clothes themselves, go to the shower, go to the toilet, doing their own business, able to drive, and in certain cases, primary breadwinner as well. So when you get stroke and they start to be unable to actually do the things that they actually were able to do before that, they start to actually lost their identity in the community and in themselves as well. So it can be really, really
psychological as well.
Exactly. It can be psychologically debilitating. A lot of our patients deal with depression, and that's quite common and quite challenging to actually tackle on, especially when you think about motivations that's needed to actually really join rehab programs. So in terms of the statistics-wise, unfortunately, 15% will actually die after stroke quite shortly. 10% will actually survive without, much of impairment, almost completely improve. But more than 50% would actually have moderate to severe impairments to the point that they require assistance from others around them. So about 10% actually have to go to nursing home or long-term care facility because they require a lot of help or assistance to actually, to even feed themselves, to even put on clothes, to even brush your teeth, to even, going to the toilet and showering and all that. And, walking as well.
Yeah. I know someone who's very close to me. He's already in his 70s, but he was a very active man, someone closely related to me. Very active man, very self-reliant. He used to get up in the morning, go for his walks, go to the market, and he suffered from a stroke. And then he just couldn't accept the fact that, he got a stroke. I think that's the first thing that hits them really hard. Yeah. Because they blame it on, they blame it on everything else except them because they feel that they had a good lifestyle. They ate well, they exercised, but then things, like you said, age catches up the better of you.
Exactly.
And, after he suffered from a stroke, as you mentioned, he had all of these symptoms that his quality of life was tremendously affected. And he had to rely on us to help him with the most mundane of things. And he never liked it.
Yeah.
He used to be very irate. He used to push us, shunt us all away. Now, I'm sure we have listeners out there who may be dealing with similar people in their families as well, Doctor.
Yeah, I'm pretty sure that we do have those. And in fact, it's really a challenge to family members when they come to us. They've been trying to do exercises with the patient. They've been trying to, do daily activities with them. But the patient themselves refuse. And the patient themselves refuse to get off the bed, do exercises, even though we know that they can actually. So it is a huge challenge, and I don't think that you should be in it alone. And I think you should have support from, the healthcare professional as well as the family members and the community.
Okay. Now we've sort of navigated our conversation to the topic of rehabilitation now, Doctor. Let's talk about that, right? As we know, of course, it plays a very vital role, which is why you're here to talk to us about. So can you maybe guide us and guide our listeners on when exactly does a stroke survivor should consider rehabilitation, and are there any specific signs, or what are the milestones that as doctors, as medical professionals, what are the milestones that you aim to achieve with someone who's coping up after suffering from a stroke, Doctor?
Okay. I think I will talk about the process of rehab in acute setting would probably make more sense. So actually, referral to rehab can be as early as 24 to 48 hours. In fact, if you have stroke units, then you will have rehab on board, actually. And if provided that they are medically stable, in the sense that the blood pressure is not too high, the diabetes is actually not, haywire and all that, and they can actually engage in rehab services. They can start as early as 48 hours, actually. So in the most ideal setting, all patients who had a stroke should get a referral to rehabilitation team. And in terms of, doing the assessment of who get what kind of rehab, like we have inpatient and we have outpatient rehab. So usually what will happen is that the rehab doctors will come down to see the patient who have just recently had a stroke, assess them. So assess them medically wise, are they stable? And then assess them, are they ready in the sense of their mood, their motivations and all that. And assess them in terms of physical parts, what kind of rehabilitation that they would actually need, and what kind of recovery or prognosis that you'll be thinking about. And we do have some algorithm to actually predict recovery of stroke.
Algorithms, wow,
yes.
Technology.
But then, it's not really technology per se. It's more like we look at the weak, how weak are the arm or how weak are the hands, that we actually predict the hand function or the ability to walk up.
Right. So in benefit of hindsight, then that's when you make an assessment, right?
Yeah. So we do that assessment, and then if we think that the patient is suitable for inpatient intensive rehabilitations, then we will actually counsel them for admission to rehabilitation ward. So in rehabilitation ward, depending on the needs, we will give them physiotherapy, speech therapy, and occupational therapy sessions, as well as the doctors will always manage their medical issues.
Okay. So, Doctor, you mentioned about physiotherapy, speech therapies. These are all therapies that fall under the large umbrella of rehabilitation.
Exactly. We work in a team. So we are actually a multidisciplinary team where every members are important. And the main center of our team is actually the patient and the family.
Okay. So it revolves around that.
Exactly.
Yeah. And how long, what's a typical time frame for someone who is undergoing rehabilitation? How long does it usually take to completely rehabilitate their movement, so to speak? How long?
Well, it depends on each patient, individualized condition. So, and it depends on the severity of the stroke themselves. Particularly, it takes about 3 to 6 months to actually, get recovery. And we call it 6 months actually as golden period, because within that, for the neurological recovery, meaning in terms of your muscle power and all that, usually it peaks around 3 months. But in terms of functional recovery, meaning your ability to do feeding yourself, going to the toilet and all that, they typically actually peak around 6 months. But a lot of research has shown that even up to 2 to 3 years, you can still regain some functional recovery. So we always emphasize to our patients that the first 6 months are the most important.
Most crucial.
So yes, exactly. So if you want to have like good recovery, you should do intensive rehab at that point of time.
So if the right emphasis is not given within that golden period, then it would affect the quality of their life one way or another then.
Exactly.
Okay.
But then it doesn't mean that, after 6 months there's no use anymore. You still need to see rehab. And if you haven't got rehab in the first 6 months, you should still see and do assessment and all that and see where we can actually help you. Because as we mentioned before, even up to 2 to 3 years, there are some functional recovery available still. It's just at a lower rate compared to the first 6 months.
Now, Doctor, I'm interested to know, to what extent is rehab able to, rewind their, their functionality back to how it was? To what extent? You get what I mean? It's like, after a stroke, their movements, their cognition severely got affected, which is why they get induced into rehabilitation. So to what extent are doctors or the rehabilitative process is able to bring them back to where they initially were? 100% possible? Medically?
It depends on patient to patient, to be honest with you.
Right.
And each patient are actually different.
That's a revelation.
Exactly. So it depends on the severity, the personal factors, and the environmental factors of the patients, and how complex the medical conditions are for the patient. In certain cases, yes, we managed to actually get 100%.
Wow, really? Okay.
Yes, but those are the ones that has minor impairments and fully motivated to actually, involved in rehab programs. But when you have a more complex that have a lot of confounding factors, that's why it's a bit more challenging. To be totally honest with you, we don't really exactly have like statistics to say, how many percent, how many percent per se. But in general, the recommendation, like global recommendation, is that somebody who survived a stroke should actually get rehabilitation as a multidisciplinary approach, because that can actually optimize their function and actually reduce their mortality and morbidity as well and prevent complications.
Right. A multi-pronged approach, right? So it's apart from medication, rehabilitation also has to be given equal importance. Very interesting, because, sometimes you wonder if, these rehabilitative processes will be able to tweak them back to. But what really caught my attention in what you said is that it really depends on the patient as well. It depends on how badly they want to, improve the situation.
So, in certain cases where you kind of prognosticate them as poor, the one that probably won't be able to walk, but we have seen cases where the patient has no power on the affected leg, but because of sheer motivation, so he do all the physical therapy, do all the gait training, and was able to actually walk.
So, doctor, how do you motivate someone who doesn't really have it in them to bring themselves out of it? I'm sure listeners want to know, right? These are the things that really invoke our listeners' minds. So how? How do we, if I have a mom, a dad, or an uncle who's just lost it in him and he doesn't want to bring himself out of the condition he is in after a stroke, how do we motivate them?
Okay, I think it's a long-term process, to be honest with you. And it actually depends on their own personality pre-stroke as well. We found that those who, pretty motivated even before stroke, they may actually fare better compared to those who are not. But when it comes to having a stroke, as we mentioned before, it's a shock to the whole system.
It is.
The news that you actually got a stroke. Why did I get a stroke? Why XYZ didn't get a stroke, but it's me. So it's a shock to their system. So it takes time for us, the doctors, the nurses, our therapists as well, to explain to the patient, this is stroke, this is what happened. Sometimes we also show them the brain imaging on what's going on in the brain, so that they can understand it better. And to that extent, that when they understand the disease process, I think they could accept it better. And we also would actually try to motivate them as best as possible that, with rehab, we can try to actually help you. Like, honestly, there's no guarantee, to be honest. There's no guarantee. Yeah. But then it's better than, not doing anything. And evidence lately has been showing the positive effect of rehabilitation post-stroke anyway. Right. So it's better to actually involve yourself in stroke. rehab afterwards.
Okay.
And in terms of the motivation, sometimes we also, depending on, the social background, we look at where we can actually introduce them to counselors. We can introduce them to preachers that can actually help them to actually accept things that's going on. And if it severely affects their mood, it affects their sleeping, it affects their ability to actually involve in a rehab program, then we can actually offer to refer to our psychiatrist friends to actually provide either support or if it's really severe, then medications.
I think you added a lot of important points there to enhance the understanding of our listeners that someone who suffers from stroke doesn't necessarily only need medication. Apart from that rehabilitation, they may also need some counseling, psychiatric help as well. And that's very, very nice, very important things that you mentioned, Doctor. Thank you very much for highlighting that to us. Now, here's another begging question that I've been having, and I'm sure our listeners have. Supposing someone suffers from a stroke once, are they susceptible to suffer another stroke?
Unfortunately, yes. And I think some of my patients are actually shocked about this idea that you can get a lot of strokes at different times.
Okay.
So when you think about recurrence, at 1 year it's about 11%.
Okay.
And at 5 years it's about 26%. And if you think about recurrence, is that it causes more damages.
Okay.
So you had a first stroke, then you had the damages to your brain, and then your brain by neuroplasticity they try to rewire and all that, and you gain some recovery because of the rewiring and the training and all that, and then somewhere down the line you get another stroke. That's another area of damages. They typically occur in the same regions of the vessels that's affected, but in certain cases where you have a generalized vascular disease, then you can actually have multiple sites.
Okay.
So the more damages to the brain, the more brain tissues that's actually affected, the more disabilities that you would have or impairments.
I see.
So it is very, very important for them to actually, if you have high blood pressure, you have diabetes, you have to actually make sure that the control is good.
So everything becomes very fragile the moment they suffer from the first stroke.
Exactly.
Then.
So if you already had a stroke compared to somebody who never had a stroke, but have the same risk factors like high blood pressure and diabetes and all that, a person who had a stroke before is higher risk compared to a person who never
suffered a stroke before.
Exactly.
Right.
And we do see patients who had recurrent stroke. I've seen quite a number, and sometimes it's because he forgot to take medications, or the family members doesn't actually serve the medications and all that.
Okay.
So each stroke that they come with actually wouldn't say progressive, but it's just that it gets worse and worse.
I see.
Yeah.
I see. Great. Lots of interesting things you spoke about, touching on the brain. That's something that I often like to read as well online, especially neuroplasticity. Dr. Huberman, I like to watch him on on YouTube, where he speaks about how the brain adapts to new things and how he can use neuroplasticity to learn new languages, new skills, and so on.
Exactly.
And I think you will be a very good guest to speak about matters on the brain, Doctor. But never mind, time is of the essence right now. We're really short of time, but we had a very interesting conversation with you, Dr. Sakinah Sabirin, and you shed some light on stroke rehabilitation. Thank you very much for being on Health on Tracks, and we look forward to having you again in the studios, yeah?
Thank you very much for having me today.
Of course, the pleasure is ours. And before we part ways with our listeners, I think you have got something that you want coming up on air next up by one of your favorite singers. Maybe you can introduce that song for us, Doctor. Take it away.
Okay, maybe we can have a listen to Ed Sheeran, Shivers.
More energy, Doctor. All right, coming up is Shivers by Ed Sheeran up next, and then after that is the news. I'll see you in a bit.
You're listening to Trax FM's podcast. If you've enjoyed our content, more podcasts are available on the RTM Click app and website. Let us know what you think. Please email us at traxfm.rtm@gmail.com. Like and follow us on social media at Trax FM Official.